Blood pressure is the force exerted by circulating blood against the walls of blood vessels, primarily the arteries, as the heart pumps it throughout the body. Blood pressure is measured in millimeters of mercury (mmHg) and is expressed as two values: systolic pressure over diastolic pressure. Systolic pressure. The top number represents the systolic pressure. It reflects the maximum force exerted on the arterial walls during each heartbeat. Diastolic pressure. The bottom number represents the diastolic pressure, which indicates the pressure in the arteries when the heart is at rest between beats. It reflects the minimum pressure in the arterial system. Normal blood pressure is typically defined as a systolic pressure below 120 mm of mercury and a diastolic pressure below 80 mm of mercury, expressed as 120/80ths of a millimeter of mercury. However, blood pressure ranges can vary depending on factors such as age, health conditions, and individual characteristics. High blood pressure, or hypertension, is diagnosed when blood pressure consistently exceeds the normal range, generally 130/80ths of a millimeter of mercury or higher. Diabetes is a chronic medical condition characterized by high levels of glucose, sugar, in the blood. It occurs when the body either doesn't produce enough insulin hormone that regulates blood sugar or cannot effectively use the insulin it produces. Insulin is essential for allowing glucose to enter cells, where it is used as a source of energy. There are three main types of diabetes. Type 1 diabetes. This type typically develops in childhood or adolescence and occurs when the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. People with type 1 diabetes require lifelong insulin injections or the use of an insulin pump to manage their blood sugar levels. Type 2 diabetes. This is the most common form of diabetes, accounting for the majority of cases. It usually develops in adulthood, although it is increasingly being diagnosed in children and adolescents. Type 2 diabetes occurs when the body becomes resistant to the effects of insulin or fails to produce enough insulin to meet the body's needs. It is often associated with lifestyle factors such as obesity, physical inactivity, and unhealthy eating habits. Gestational diabetes. This type of diabetes occurs during pregnancy when hormonal changes can lead to insulin resistance. It typically resolves after childbirth, but women who have had gestational diabetes have an increased risk of developing type 2 diabetes later in life. Common symptoms of diabetes include increased thirst and urination, unexplained weight loss, fatigue, frequent infections, blurred vision, and slow wound healing. However, some people with type 2 diabetes may not experience noticeable symptoms. There is a significant relationship between diabetes and blood pressure, and the two conditions often coexist. This association is known as diabetic hypertension, or hypertensive diabetes. Having diabetes increases the risk of developing high blood pressure, hypertension. In turn, high blood pressure can further worsen the complications associated with diabetes. Diabetes and high blood pressure share several common risk factors, such as obesity, physical inactivity, unhealthy diet, high in salt and saturated fats, and family history. These risk factors can contribute to the development of both conditions simultaneously. When diabetes and high blood pressure coexist, the risk of developing serious complications is significantly higher. These may include heart disease, stroke, kidney disease, eye problems including diabetic retinopathy, nerve damage, and poor wound healing. Managing high blood pressure and diabetes involves a comprehensive approach that includes lifestyle modifications alongside any prescribed medications. Excessive salt intake is known to contribute to the development of high blood pressure, hypertension, for several reasons. Fluid retention. Consuming high amounts of salt can cause the body to retain water. When there is an excess of sodium in the bloodstream, the body tries to maintain a balance by retaining water. This increased fluid volume puts additional pressure on the blood vessel walls, leading to elevated blood pressure. Increased blood volume. The retention of water due to high salt intake increases the overall blood volume. As the volume of blood circulating through the blood vessels increases, it exerts more force against the vessel walls, resulting in higher blood pressure. Constriction of blood vessels. High salt intake can cause blood vessels to constrict or narrow. When blood vessels are constricted, the space for blood flow decreases, resulting in increased resistance to blood flow. This resistance can lead to elevated blood pressure. Renal function. The kidneys play a crucial role in regulating blood pressure. When sodium levels are high, the kidneys may struggle to excrete excess sodium efficiently. As a result, sodium accumulates in the bloodstream, contributing to fluid retention and increased blood pressure. Limit the sodium intake to less than 2,300 mg/mg per day, and ideally, aiming for an intake of no more than 1,500 mg per day. This can be achieved by reducing the consumption of processed and packaged foods, which are typically high in sodium, and opting for fresh, whole foods prepared at home. Reading food labels and choosing low sodium or sodium-free alternatives can also help manage salt intake effectively. Opt for foods low in saturated and trans fats, cholesterol, and refined sugars. When aiming to reduce saturated and trans fat intake, it is important to choose foods that are low in these types of fats and instead focus on healthier fat options. Most fruits and vegetables are naturally low in fat. They are also packed with essential nutrients, fiber, and antioxidants. Include a variety of colorful fruits and vegetables in your diet for a wide range of health benefits. Opt for whole grain options such as whole wheat, oats, brown rice, and whole grain bread and pasta. These choices provide more fiber and nutrients compared to refined grains. Choose lean sources of protein that are low in saturated and trans fats, such as skinless poultry, chicken, turkey, fish such as salmon, trout, sardines, legumes such as beans, lentils, chickpeas, tofu and tempeh, egg whites or egg substitutes. While nuts and seeds contain fat, it is primarily unsaturated fat, which is healthier. Include options like almonds, walnuts, flax seeds, chia seeds, and pumpkin seeds in moderation for the nutritional benefits. If consuming dairy products, opt for low-fat or reduced-fat versions of milk, yogurt, and cheese. Alternatively, consider dairy alternatives like unsweetened almond milk or soy milk. Incorporate foods that are high in potassium, as potassium can help counteract the effects of sodium. Potassium plays a crucial role in counteracting the effects of sodium in the body, particularly in maintaining a healthy balance of fluids and regulating blood pressure. Here's how potassium works to offset the effects of sodium. Sodium is known for its ability to cause fluid retention in the body, which can increase blood volume and subsequently elevate blood pressure. Potassium helps regulate fluid balance by promoting the excretion of excess sodium through urine. By increasing potassium intake, you can enhance the excretion of sodium, reducing fluid retention and potentially lowering blood pressure. Vasodilation. Potassium has vasodilatory effects, meaning it helps relax and widen blood vessels. This process improves blood flow and reduces resistance to blood flow, thereby reducing the strain on the cardiovascular system and potentially lowering blood pressure. Renal function. Potassium supports optimal kidney function, including the filtration and excretion of sodium. Adequate potassium levels help maintain the balance between sodium and potassium in the kidneys, preventing excessive sodium reabsorption and promoting its elimination through urine. It's important to note that the balance between sodium and potassium intake is key for the beneficial effects. Consuming an excess of sodium without sufficient potassium can still contribute to fluid retention and increased blood pressure. Therefore, it's advisable to maintain a healthy balance by increasing potassium intake while reducing sodium intake. Good dietary sources of potassium include fruits, bananas, oranges, kiwi, apricots, and avocados. Vegetables, spinach, broccoli, sweet potatoes, tomatoes, and mushrooms. Legumes, beans, lentils, and peas. Nuts and seeds, almonds, pistachios, sunflower seeds, and flax seeds. Dairy, milk, yogurt, and cheese. Choose low-fat or non-fat options. Fish, salmon, tuna, and halibut. Potassium-fortified foods. Some cereals, bread, and other packaged foods may be fortified with potassium. Maintain a healthy weight. Aim for a body mass index (BMI) within the healthy range, 18.5 to 24.9. BMI stands for body mass index, which is a commonly used measurement to assess whether an individual's weight is within a healthy range based on their height. It is calculated by dividing a person's weight in kilograms by the square of their height in meters. The BMI provides a general indication of whether a person is underweight, normal weight, overweight, or obese. Here are the standard BMI categories. Underweight, BMI less than 18.5. Normal weight, BMI between 18.5 and 24.9. Overweight, BMI between 25 and 29.9. Obese, BMI 30 or higher. While BMI can be a useful screening tool, it has limitations. It does not differentiate between fat mass and muscle mass, which means that individuals with a higher muscle mass, such as athletes, may have a higher BMI without necessarily having excess body fat. Additionally, BMI does not take into account differences in body composition, such as the distribution of fat and muscle throughout the body. It's important to note that BMI is just one factor in assessing overall health, and it should be used in conjunction with other measurements and considerations, such as waist circumference, body fat percentage, and individual health factors. Limit alcohol consumption. For individuals with high blood pressure, it is advisable to moderate alcohol consumption or avoid it altogether. Alcohol consumption can elevate blood pressure through various mechanisms. Dehydration. Alcohol has a diuretic effect, which means it increases urine production and leads to dehydration. Dehydration can cause a temporary increase in blood pressure. Activation of the sympathetic nervous system. Alcohol can activate the sympathetic nervous system, which is responsible for regulating various bodily functions, including blood pressure. Activation of this system can cause blood vessels to constrict and result in an increase in blood pressure. Disruption of hormonal regulation. Alcohol consumption can disrupt the hormonal regulation of blood pressure. It can increase levels of hormones like cortisol and adrenaline, which can raise blood pressure. Increased heart rate. Alcohol consumption can lead to an increased heart rate. This increased heart rate can put additional strain on the cardiovascular system and lead to elevated blood pressure. Weight gain. Alcohol is calorie-dense and can contribute to weight gain when consumed in excess. Excess weight and obesity are risk factors for hypertension. Interference with medications. Alcohol can interact negatively with certain medications used to treat high blood pressure. It may reduce the effectiveness of these medications or increase their side effects. It's important to note that the effects of alcohol on blood pressure can vary depending on the amount consumed, individual tolerance, and overall health status. Reducing alcohol consumption or avoiding it altogether can be beneficial for blood pressure control and overall cardiovascular health. If you choose to drink alcohol, it's important to do so in moderation and be mindful of its potential effects on blood pressure and overall health. Quit smoking. Smoking can raise blood pressure and damage blood vessels, increasing the risk of heart disease. Quitting smoking is crucial for overall cardiovascular health and lowering blood pressure. Reduce stress. Chronic stress can contribute to high blood pressure. Engage in stress-reducing activities like regular exercise, meditation, deep breathing exercises, and hobbies that you enjoy. Practicing mindfulness and meditation techniques can help reduce stress levels and promote relaxation, which may contribute to lower blood pressure. Find a technique or practice that resonates with you and incorporate it into your daily routine. Limit caffeine intake. While the effects of caffeine on blood pressure may vary, it's a good idea to moderate your caffeine consumption and include more of herbal supplements. Some herbal supplements may have potential blood pressure lowering effects, but it's important to consult with your healthcare professional before incorporating them into your regimen. Examples include garlic extract, hibiscus tea, and beetroot juice. Remember that these supplements should not replace prescribed medications and should be used under medical supervision. Monitor blood pressure. Regularly measure and track your blood pressure at home using a reliable blood pressure monitor. Keep a record of your readings to share with your healthcare professional for better management and treatment decisions. Get adequate sleep. Poor sleep or sleep disorders, such as sleep apnea, can contribute to high blood pressure. Aim for 7 to 8 hours of quality sleep per night. If you suspect a sleep disorder, consult with a healthcare professional for evaluation and appropriate treatment. Managing diabetes also involves a multifaceted approach that includes lifestyle modifications alongside any prescribed medications. Some of the strategies to help manage diabetes includes: monitor carbohydrate intake and choose complex carbohydrates with a low glycemic index that have a smaller impact on blood sugar levels. The glycemic index (GI) is a measurement that ranks carbohydrates in foods based on their effect on blood sugar levels. It is a scale from 0 to 100, with higher values indicating that the carbohydrate-containing food raises blood sugar levels more quickly compared to foods with lower values. Here's how the glycemic index works. Low GI foods. Foods with a low glycemic index, usually 55 or less, are digested and absorbed more slowly, leading to a gradual and modest increase in blood sugar levels. These foods have a more favorable impact on blood sugar control. Examples of low GI foods include most non-starchy vegetables, whole grains such as oats and barley, legumes, and fruits. Moderate GI foods. Foods with a moderate glycemic index, typically ranging from 56 to 69, are digested and absorbed at a moderate rate, resulting in a moderate increase in blood sugar levels. Examples include whole wheat products, brown rice, sweet potatoes. High GI foods. Foods with a high glycemic index, 70 or higher, are rapidly digested and absorbed, causing a quicker and higher spike in blood sugar levels. Examples of high GI foods include white bread, white rice, sugary snacks, sweets and beverages. Vegetables and fruits play an important role in regulating blood sugar levels for several reasons. Vegetables and fruits are rich in dietary fiber, which can help regulate blood sugar levels. Fiber slows down the digestion and absorption of carbohydrates, preventing rapid spikes in blood sugar after a meal. It also promotes satiety, helping to control appetite and manage overall food intake. Many vegetables and certain fruits have a low glycemic index and are rich in antioxidants, including vitamins such as vitamin C and vitamin E, minerals such as magnesium and zinc, and phytochemicals. Antioxidants help protect cells from damage caused by unstable molecules called free radicals. Weight loss, if overweight, can improve insulin sensitivity and blood sugar control. Engaging in regular physical activity is an essential component of weight loss and overall health. Here are some activities that can contribute to weight loss. Brisk walking. Walking at a brisk pace can be an effective low-impact exercise for weight loss. Running, jogging. Running or jogging helps burn calories and improves cardiovascular fitness. Cycling. Riding a bicycle, whether outdoors or using a stationary bike, is a great cardio exercise. Swimming. Swimming is a low-impact, full-body workout that can aid in weight loss. Dancing. Dancing not only burns calories but also adds fun and variety to your exercise routine. Blood sugar monitoring. Regularly monitor your blood sugar levels using a glucose meter as advised by your healthcare professional. Blood sugar monitoring is an essential aspect of diabetes management. Regular monitoring helps individuals with diabetes understand their blood sugar levels, make informed decisions about the diet, physical activity, and medication, and take appropriate action to maintain stable blood sugar control. Here's an overview of blood sugar monitoring. Glucose meters are handheld devices that measure blood sugar levels. They typically require a small drop of blood obtained by pricking the fingertip with a lancet. The blood sample is placed on a test strip, which is then inserted into the meter to provide a blood glucose reading. Hypoglycemia and hyperglycemia management. Regular blood sugar monitoring allows individuals to identify and manage hypoglycemia, low blood sugar, or hyperglycemia, high blood sugar, promptly. With the guidance of a healthcare professional, individuals can adjust their food intake, physical activity, or medication to address these conditions. Managing high blood pressure and diabetes involves a comprehensive approach that includes lifestyle modifications and balanced diet. Remember, while these methods can be helpful, they may not replace the need for medications in some cases. It's important to work closely with your healthcare professional to develop a comprehensive treatment plan tailored to your specific condition and monitor your progress over time.